Our next speaker is going to be Mario Bizzini from Switzerland. He's going to talk to us about return to sport after hip surgery in athlete. And Mario is very involved with the FIFA and soccer players. I'm looking forward for his talk.
Maybe someone can help me, maybe, for the... Can use with mic, sorry. Oh, excellent, yes, thank you. Thank you for the introduction, thank you for the nice invitation for a fantastic conference for many involved people in this topic. I will speak here on behalf of my colleagues Casartelli and Dr. Leuning of the Schultes Clinic. This is the outline of the presentation. First, an updated systematic review on this topic. Then, what we understand or should understand on the return to sport, pro and amateur athletes, then something that already been addressed, surgery, complications, and then by the end, some rehab and training considerations. So background, as we have heard, there is an attempt in eliminate or at least reduce pain, improve function, and then possibly return to sport. And then with maybe the historical hypothesis to decelerate the degenerative changes. So here we conducted recently a systematic review on this topic, kind of an update of the presented review. By the end we had 18 papers, 14 on arthroscopy, 3 on open surgery, and 1 on mini open surgery. Interestingly, from the methodological standpoint, they are all case series, so level 4. Also interesting to see 13 retrospective, only 5 prospective. Return to rate sports a bit lower than what we have seen in the previous one, 85% at mean 2.2 years follow-up, and 81% to pre-injury level at the same follow-up rate. So here just is a not complete list, and typically, as we have heard, most of them deal with pro athletes and recreational athletes, and then with these two type of surgeries. So what has been also seen in other systematic review, very excellent one by Johan Kemp here present. So generally a low methodological quality with, of course, high risk of bias because there are no randomized controlled trials. And then also a lack of valid, reliable, and responsive outcome measures. So as an example, in these 18 papers, only 6 use the HOS score. And then also usually a lack of details of rehab and training protocols. Also interesting how to define return to sports. So of course, there are many, can be seen differently. So return to sport-specific tests or sport-specific training, unrestricted training, return to play to compete. This is, of course, for the pro athlete what counts. And then to the pre-injury level, which is usually the most indicative if properly documented. We have seen most studies deal with pro athletes. We have across this low quality study more pro than amateur athlete return to sports, also return earlier after arthroscopy. And then in amateur athletes, there is a trend to change and to shift the sports or to discontinue the sports. Here, maybe interesting is this publication by Null from our group, looking at a retrospective cohort, but showing how patients with high impact sports before surgery, then they change into low-impact sports looking at long follow-up at 5 years. We have heard about surgery. The two main approaches, open versus arthroscopic. It must be acknowledged that there is no comparison study yet today. Most study deals with arthroscopic surgery, especially in pro sports. Maybe it's also the best situation because usually the guys, they want to go back. Absolutely. From the available data in these papers, as an example, in ice hockey, there is clearly after an arthroscopy a quicker return to sport, at least than with an open procedure. Maybe some questions still open about the long terms. Usually lower numbers are reported at follow-ups, maybe pain, maybe retirement of this player, maybe other reasons. The issue with the cartilage lesion has already been addressed. So from this series of papers, at least in the short term, as we have seen, microfracture seems also to lead to higher return to sport rates. Then something also to take into the equation are self-reported outcomes. Even if there are in only few papers, we have validated outcomes like the HOS. Some also report a so-called satisfaction score. And interesting to see is that often the return to sports rates, they are not always positively correlated with satisfaction and sporting ability. And in this direction, something that has been looked into a little bit in detail by Mannion and Pellizzeri is the expectation of patients. Now here is in a recreational cohort, expectation of FAI surgery that are mostly overly optimistic. And there are a series of expectations, and the most important one is, of course, the pain. If there is clearly reduced pain, then it is perceived immediately as a good outcome. And then the ability to do some kind of sports, it's also the number two expectation. So coming to rehabilitation protocol, although it is recognized as an important component in the hip management after hip surgery in athlete, then also here we have limited evidence on current guidelines. We have many holes in the process, but typically lack of return to play criteria and protocols, lack of valid, reliable, and so responsive outcomes, and even more when we go into sport specificity. So here is maybe it's not a complete list, but a possible complete list of the publication in post-surgical hip rehab. As mentioned, level 4 to 5, experts' opinion or case reports. Here, the last two of the two groups here presenting, so mostly two case reports on ice hockey player and goaltender with a very detailed description on the protocols. And then recently in the International Journal of Sports Physical Therapy, there are also some papers in this direction. Here two that we had published in a couple of papers with a combination of time-based and criteria-based protocol to bring back ice hockey players, professional ice hockey players after open procedures, where in the criterion base there is a focus in trying to possibly control the progression in terms of optimal neuromuscular control and then going into the sport-specific phases. Here is just an example of the progression with many elements. One of the most crucial, at least from the empirical standpoint, is the neuromuscular control, which can be promoted through different type of strategies and exercises. And the goal is really to optimally prepare and reconduct the athletes toward his or her ability. In the process, as we have heard by the excellent presentation of Christian Torborg, it's also of importance to monitor, or at least try to monitor what is known at least today, and if muscle strength assessment are a very important part of this. This is again an example recently published by Casartelli in Physical Therapy in Sports. It is a case report of a pro player with a bilateral hip open surgery, and where this, as an example, these hip strength measurements, they were used regularly to monitor not only strength but asymmetries between left and right, and surely an important tool in the process. Then when we continue, of course, one thing is to have the athletes in the gym, but we have also to bring back to the field. Here is some example in soccer with specific activities targeting at reactive neuromuscular control and stabilization and many other issues. Here's some example in ice hockey, where the athlete by the end must try to reach really the previous level in terms of explosivity, quickness, very important parameters. That's also why, at least from the work with the athletes, often is a gradual and progressive return important. Also, I need to differentiate between different situations. Are we going back with the player alone? Are we going back to reduced practice, no contact, with contact, full practice? And then, then back to the games, is it a real game, or is this a friendly or just a test game? Here we have to acknowledge there is really even more important a lack of valid, reliable tests, especially when we think about surgery or injury. Some that can be used are the validated ones. As an example, in soccer, we have the yo-yo intermittent test, we have the repeated sprint ability test with numerous publications, and used to really document and see if the player really get back to either the previous injury level or at least to a team average. So very important to monitor what's happening towards the real competition. And similar in ice hockey, something that can be used are validated tests on ice. As an example here, the battery published by Gillenstam, with a possibility to monitor the speed, the explosivity, agility in on ice situation. And then, of course, as we all know, it's not only about the hip. We have the sport-specific fitness, the skills we have seen, but there is also a lot to do with mental readiness, the confidence, no fear of re-injury, just to mention a couple of aspects. And then also we need to be aware that as part of the medical team, we are just some actors in the whole process, especially when you think at pro level. So you have also the coach, you have the club, you have an association, and these are all different opinions that then by the end define when an athlete really is back on the field, or maybe he's still on the bench, even if he is maybe ready, and so forth. So just to summarize some key points, we have seen so-called high return to sports rate. We have to acknowledge with a limited evidence today. We have seen these best examples in pro players, maybe also a special situation. Then we have the role of surgery, role of rehabilitation, and also again here to acknowledge low level of scientific evidence, really a strong need of, if not randomized controlled trial, but at least better methodological studies in many directions, going from the conservative treatment to post-surgical protocols, criteria, and then all the range of outcomes. Just take one slide to invite you all. Next year in Bern, Switzerland, we will have a return to play international conference by the Swiss Sports PT Association, the International Federation of Sports PT, and then officially partnership with the British Journal of Sports Medicine. So I thank you for your attention, and I wish Rob a good keying presentation.